You're taking the anti-nausea medication your oncologist prescribed. Maybe you're even taking it exactly as directed. But the nausea, it's still there. Not all the time, but enough that it's wearing you down. If that sounds familiar, you're not alone. And more importantly, this is something we can usually improve. Let's talk about why nausea during treatment can be so stubborn, and what helps when one medication isn't quite enough. Here's the key thing about cancer-related nausea. It usually doesn't have just one cause. For some people, it's driven by how the brain responds to treatment, which is why nausea can even show up before an infusion. For others, it's more physical. Some treatments irritate the stomach or slow digestion, leading to a lingering queasiness that worsens with eating. The reason this matters is simple. Different causes respond to different approaches, which is why nausea control usually works best when strategies are layered together. When nausea isn't improving with medication alone, we usually need to think in layers, not steps. Medication is often one layer, and sometimes that means more than one drug, or taking them at different times. Another layer is timing and patterns. When nausea shows up matters, whether it's right after treatment, first thing in the morning, or later in the day. Food and hydration are another layer. This isn't about forcing meals. It's about finding what your body can tolerate and using that to stay nourished and hydrated. And then there's environment and routine. Small changes, where you eat, what smells you're exposed to, how you sit or lie down, can quietly make a real difference. No single layer works perfectly on its own. But when you start combining them, that's usually when people begin to feel more in control. Let's zoom out for a moment. When nausea isn't fully controlled, it's rarely because one medication failed. More often, it means the plan needs fine-tuning. Different anti-nausea medications work in different ways, and how and when they're used matters just as much as which one. For some people, nausea breaks through at specific times of day. For others, it's tied closely to treatment itself. That's why oncology teams often adjust combinations, timing, or dosing, sometimes even before symptoms show up. The important thing to know is this: needing those adjustments is expected. It's a normal part of supportive care, and it's something your team is used to managing. Now let's talk about food and drink. The goal isn't a full meal. It's keeping something in your stomach without making nausea worse. Smaller amounts, more often, tend to work better than large meals. Temperature matters. Cold or room temperature foods are usually easier to tolerate than hot ones, since heat and strong smells can trigger nausea. Liquids count. If solid food feels difficult, sipping fluids can still help with hydration and sometimes calm the stomach. And bland doesn't mean boring. It just means avoiding foods that are greasy, spicy, or very sweet, the ones most likely to worsen symptoms. Environment matters more than people expect. Strong smells can trigger nausea, so fresh air helps. A fan, an open window, even just getting air moving can make a difference. Where you eat matters too. If one spot is closely tied to feeling sick, try changing locations. Posture matters as well. Lying flat after eating can worsen nausea. Staying upright for a bit gives your stomach time to settle. And one important point: don't force food when nausea is at its peak. Wait for it to ease, even if that means eating at unusual times. Your body will usually tell you when it's ready. Let's talk briefly about anticipatory nausea. This is when nausea starts before treatment even begins. It happens when the brain links certain cues or routines with feeling sick. It's common, and it's frustrating. Small changes can help. Distraction, breathing techniques, or adjusting your routine on treatment days. And if it's making treatment harder, talk to your team. There are options that can help. And sometimes simply mentioning it makes it easier to manage. So when should you call your care team? If you can't keep fluids down for more than 12 hours, if you're eating so little that weight is dropping, or if nausea is preventing you from taking your other medications, that's a reason to reach out. You should also call if nausea isn't improving despite medication adjustments. There are additional options, and your team would rather know sooner than have you struggle through it. Nausea during cancer treatment can feel relentless, but it's also one of the symptoms that often improves when it's approached from multiple angles: medications, timing, food, and environment. It can take some trial and error and clear communication with your team. But most people find a combination that helps. You don't have to manage this alone. This is Oncora Health, practical, clinician-guided support for getting through treatment.